You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, sedation dentistry. With us, we have an expert on the topic, Dr. Meis. Dr. Meis, welcome to the program.
Welcome, Randy. Thanks.
Now, before we get into today's topic, tell me a little bit about your practice.
Well, we have a general practice, and we serve everyone from children to seniors, the whole gamut. So for kids, we do things like cleanings and fillings and sealants to prevent decay.
All right.
As kids get a little older, they become teens, then often that's the time when they have orthodontic problems. So we talk about how we can make their teeth straighter and look better.
You do Invisalign, things like that?
We sure do, yeah.
Okay.
Invisalign is a series of clear plastic aligners that each aligner slowly steps the teeth into their proper position, and it's a very, very simple way to have straight teeth, and it really works
You do
well.
dental implants?
Dental implants are a way that you can replace a single tooth or replace a whole mouthful of teeth. They can also be used to lock dentures into place. Many people who have dentures over time, as the ridge that the denture sits on shrinks, which is a natural process, their dentures fit less and less well. They're able to eat the foods that they enjoy. And dental implants is a way to lock those dentures in place so that they can eat the things they like, so they can smile, so they can laugh without thinking about it, without being self-conscious.
Is it true, though, two dental implants can give a denture like snap in, snap out? Is
absolutely.
That right?
Yep, absolutely. Two dental implants on the lower arch. They're fitted with a special snap-on cap, and so the denture snaps onto those implants, and it keeps them from moving. It's tremendous. And we do cosmetic dentistry. We do all phases of cosmetic dentistry, from the simplest, which would be whitening, to some a little more complex things with bonding, all the way to doing porcelain veneers.
Okay, now let's talk about your background before we get into it. I know you brought some patient photos, but your grandfather was a dentist? I think
my great-grandfather was a dentist.
Right?
Yeah, my great-grandfather was a dentist. My grandfather was a dentist. My father and uncle were dentists, and I was lucky enough to follow in their footsteps.
I asked you said you have pictures.
Yeah, I do. Yeah, Randy, this picture is of my great-grandfather's dental office, and his dental office was back there on the porch. There, there's a little sign that says office. Yeah, on the left. And it says office.
Oh, yeah, I see that.
In the front yard of this house, you can see the family sitting there. So the man is my great-grandfather. The little
rocking chair.
You got it. The baby on his lap
Okay.
is my grandfather. And so that picture is from about 1902 or so.
Did you know you always wanted to be a dentist?
You know, I really was always attracted to it because I was around it. I started working in my dad's dental office when I was probably in about the 4th grade, helping with cleaning things and organizing things.
So you've always been a dentist, it seems
Yeah,
like.
it seems that way, yeah. So I've really always been drawn to it. I think it's a really wonderful way to help people, and I just find it just an extremely rewarding field. Every day, Randy, I get to go home knowing that I helped somebody. Every single day.
I mean, you believe that. You feel like that.
Absolutely. Every single day. Every single day. I do.
Okay, so you know the point of this show, and we invite you in the program to talk about this, is that there's a lot of people that don't go to the dentist because they're so anxious.
Yeah.
So what do you say to them?
You know, the research shows that it's about 15% of our population does not go to the dentist because they're too fearful to go. And so how I help
are
people
these
with
successful people?
Oh yeah, it has nothing to do with their place in life. We've seen people that are corporate executives that have dental anxiety and very, very severe dental problems. As you know, it's just the whole gamut of our population has it. It has nothing to do with your position. So what we were able to do is we were able to show them how we can help the conditions that they have, how we can make that better. And then we talk about sedation and how we can do it when they're in this very deeply relaxed state.
So IV sedation, I mean, is one safer than the other?
IV sedation is my preferred method, and here's why. Yeah, several reasons. Number one, you can adjust the level so accurately. And when I say to people confidently that I know that I'll be able to keep you comfortable, it's because we use the IV. We can add more medication. If you're not at that really comfortable, conscious sedation pace, no, not at all. No, not at all.
So they completely forget the procedure then?
Yeah, that's right. Yep, they may have a little piece of memory of, you know, maybe something I said is usually what people tell me they remember. Or they don't remember anything at all. Or they don't remember anything, you know, for even hours after.
So
sometimes
even for the older patient? I mean there must be anxiety
Yeah.
even about the IV sedation too, right?
For some people, there is, and that's why we give a medication ahead of time to relax people, an oral medication ahead of time to relax people, so that when we use the IV, it just is so quick and so simple that it really isn't that anxiety producing for people.
Now, what about things like just cleanings?
Yeah.
Filling a cavity. I mean, will you use sedation for that, or just big cases?
We use it for all procedures. It's not based on the procedure. It's based on the patient and what the patient needs and their anxiety level. It's basically just helping them get through the appointment that they are so anxious about. So we have people that will come in, they're very anxious. We use the IV sedation. We're able to do, a simple filling or remove a tooth.
Is that
or whatever
right?
you need. Yeah, it can be that simple.
So 45 years old, 50 years old, my notes from our conversation on the telephone, you said these are people that haven't seen the dentist sometimes in 20 years.
Yeah, you'd be amazed.
I mean, is that common, right?
Yeah, you'd be amazed how many people are walking around like that. And it's really tragic because these people are suffering, and they don't need to suffer.
What do you mean suffering? What do you mean suffering?
It's hard for you to imagine, but there are people who don't smile, smile in public because they're ashamed of how their teeth look. And so they'll walk around, and can you imagine having one of those moments that is just so joyful in your life and you just would spontaneously break into a smile? These people don't. They just, at that very joyful moment, they
Do they tell you that?
Yeah, I hear it every day.
They're that ashamed of their smile?
Yep, I hear it every day. And so by using IV sedation, we can reduce their anxiety, and that way they can have a smile that they're proud of. One of my mentors told me that life is too long to not have a smile that you're not proud of, and I really believe that.
It's a good one.
The other group of patients that really benefit from this is people that have really severe dental problems, and they know who they are often.
Like what, for example?
Like broken teeth, like infections. People will have swellings, they'll have little boils on their gums, they'll have gum disease, they'll have real bad breath, loose teeth, things like that. Very common, I see people like that, and the sedation works great because they can get a lot of treatment done at one time. And so it's not going back to the dentist over and over and over, taking care of one tooth or two teeth at a time. We're able to take care of a whole mouthful in a visit or two. And so because we're able to do that, it really helps people that are also very busy. One of the things that I hear from people is, I want to get this done, but I don't have enough time. Well, we can make it so that it's done very, very quickly.
So multiple things all in one shot. Because
absolutely. Yep, we do it every day.
So, something I'm picking up on. It must make it easier for you as a dentist if somebody that's anxious is IV sedated as well. I mean, you could do a better job probably.
Certainly.
Is that right? They're not flinching?
Many of these people are too anxious that there's no way that you're going to do the treatment when they're not sedated. They just can't emotionally go through the experience. So it makes it for those people much easier for everyone. Technically, it doesn't necessarily make it a whole lot easier for us. No, not really.
Okay.
But it really makes it easy for the patient. And sedation is really about the patient. It's not about the dentist. It's about the patient. It's about someone who's severely anxious. It's about decreasing that anxiety so that they're able to go through the process, so that they can have the smile that they want, so that they can be able to function normally, and so they can finally have a healthy mouth. And a lot of these people have been worried about this and thinking about it for years, Randy.
Now, the guys that do IV sedation and oral sedation, our program airs throughout the United States, and anticipating this interview, talk to my anesthesiologist buddy because I'm very skeptical.
Yeah.
I say, is it overkill to do IV sedation? And he explained to me that a pill for some people isn't enough. Depending on if they're on pain medications or other issues.
Absolutely.
What are your thoughts on that?
The problem with the pill, Randy, is this: that you take the pill and you get an effect.
Okay.
That's the only effect you get. So for some people, they're very comfortable. For some people, they're not comfortable enough. And that's why I like IV sedation, because you can add another medication.
Can you reverse it with IV?
With IV sedation, it's the perfect reversal. We have a medication that reverses all of the sedation. It does it very, very quickly. And when you have an IV going, the medication goes in the IV, and it works within a minute. It's amazing.
Now, of all the topics, because I said, look, our show, we're launching it in Iowa. We're throughout the United States, and you said, I really want these highly anxious patients. You think they're underserved?
Randy, here's the thing.
Options?
Most of them don't know that sedation is available.
Really?
Yeah, most of them don't know. And when they find out that it's available, of course they're a little skeptical and anxious because they have anxiety, But
and you do it, right? Because some guys bring in another person, right?
Yeah, no,
right?
I have the training to do it. You bet. And in the state of Iowa, you have to have a tremendous amount of training, and you have to go through a certification process that's extremely rigorous, which is why there are so few general dentists that do IV sedation, because it's just so difficult to get a certificate to do it.
So what are the fears, by the way, these people have? I mean, what do they say to you? Is it just a general fear, like public speaking? Is it they had a bad dental experience early on?
You know, it
I mean,
ranges the whole
gagging?
gamut. Some people have had a bad experience that has stuck with them. Sometimes it was when they were a child. It stuck with them their entire life. Some people have had no bad experience. They don't even know why they're anxious about the dental treatment. Some people have a gag reflex that you mentioned. That's a common reason for people to be anxious because it's a very uncomfortable experience to have a gagging feeling when you're having dental treatment done. And the sedation medication works great for that. It reduces the gag reflex tremendously, and we're able to get that care taken care of while people are comfortable and not concerned about that.